Hey everyone, this is YouTube Vids. More recently on my channel, I've been posting videos specific to Ohio and the coronavirus pandemic that is currently sweeping our nation and the world. But today I wanted to spend a little bit of time covering some, I guess, what I would call unique and good websites to visit if you haven't already seen them before as this pandemic continues to make its course or hopefully complete its cycle in the United States, and while we work towards flattening the curve. These are some interesting resources that you can visit. And, again, instead of, I know everyone's got coronavirus on their mind, and, coronavirus is normally associated with negative thoughts and feelings and emotions. But this is a way that you can, essentially, cope with it possibly. And if you're sort of a numbers nerd like me, or a chart nerd like me, or you just get interested in following trends and stuff like that, this stuff will all be very interesting to you, in my opinion. So let's sit back and relax, and let's enjoy these websites I'm going to show you. So again, I've, over the course of the last 2 weeks, I've kind of gone through and actually one of these was provided to me by a friend. But over the course of the past couple of weeks, as things have been evolving, I've been looking for coronavirus-related resources, so I can publish information to my channel to fellow Ohioans on what we need to do to continue to try to flatten that curve, or get to the point where we flatten this curve. And so I think I found some pretty useful websites that I'm going to show you right now, that you can use to help maybe encourage your fellow statesmen, whatever you want to call them, to do the same. So first and foremost, again, this is the easiest one. If you've never been here before during this whole coronavirus pandemic, then I don't know how. Like you might have been living under a rock. I don't know. So first thing, cdc.gov, and again, I will publish these URLs in the comments or in the description of the video, so you can click on them there. I know you can't see them because of the overlay currently, but cdc.gov is the Center for Disease Control and Prevention. The first place, I went to and visited when this thing came up. CDC they have a link, learn more about COVID-19. You click on that link, it takes you to a page. It has this thing about the president's coronavirus guidelines for America. And for anyone who hasn't been living under a rock and have watched any amount of news, you've seen that Donald Trump and Mike Pence have been, Mike Pence in particular pulls up his little poster card of the president's 15-day plan of staying indoors and social distancing to slow the spread. And that is also available at whitehouse.gov. There's a link to that plan here as well, directly on the CDC website. But coronavirus, this website actually tells you, look, what you need to know, what the symptoms are, older adults and medical conditions, and how you prepare your family for it. Now, again, hopefully you've done some of this stuff by now, but if you haven't, then definitely read through this website. This tells you how to protect yourself, know how it spreads, steps you can take to protect yourself, avoid close contacts with others, stay at home if you're sick, cough, wear a face mask if you were sick. So this is important too. This is actually, I'm going to cover this real quick because I have not covered this in other videos. So if you are sick, you should be wearing a face mask to prevent other people from getting it. If you're not sick, you're not supposed to be wearing a face mask. One, because face masks in general have been in short supply. And so those face masks could be purchased by hospitals or other facilities that actually need those face masks. So by you going out and purchasing face masks, you're preventing possibly someone who actually needs that face mask from getting that face mask. The second part of that is that, from my understanding, again, you guys can fact check me on this all you want. That's perfectly fine. I have no problem with that. But from my understanding is that the reason why the government asked GM and some of those other companies to make those shields to protect their faces, because if your face mask is contaminated on the outside with the virus, they're supposed to dispose of the face mask right away, because it is not sustainable across multiple uses or multiple exposures of the virus. So even if they are wearing the mask, like as someone to prevent themselves from getting the coronavirus, if it's already been infected, essentially, if the mask has already been infected, then like apparently if it were to come in contact with the virus again, like you could still get the virus even though you've got the face mask on, something along those lines. So again, I'm not 100%, I'm not a doctor, so I can't, or scientist, so I can't tell you exactly how that works, but that's, from my understanding, that's how it works. So this is a very important thing that everyone should be following. Don't wear a face mask if you don't need to. Don't buy face masks if you don't need them. Clean and disinfect your surfaces. Frequently touch surfaces daily. So like kitchen counters, doorknobs, light switches. You know, if you're not normally a clean freak, now is the time to learn to be a clean freak. You know, go to the store if you can find any. Buy sanitary wipes, Clorox. You know, the Clorox bleach wipes and stuff like that. Just go through your house, your kitchen. You know, anywhere commonly touched surfaces. You know, within reason. Does it have to be daily? Probably not, but you know, you might want to try to do it daily if you can. It depends on how busy your household is, right? So keep that in mind as well. So again, you can read through all this, but this tells you how to protect yourself. If you think you're sick, here's what you can do to help prevent the spread of it if you're sick. And again, they go through all the points about calling ahead to your doctor, washing your hands, avoid sharing household items, blah, blah, blah. Monitor your symptoms. And again, the only time that people should be taking tests or going to the doctor and taking tests is if you, again, that's still right now. Currently, the only time you should be taking tests is if you are experiencing symptoms of COVID-19. So just keep that in mind, everyone. Only if you're experiencing symptoms of COVID-19 should you be asking to take the test. Because again, there's only so many tests to go around, and so you need to make sure that the people who are like dangerously sick, deathly sick, are the ones that are having the opportunity to get tested first, and possibly, you know, treated as however they can be treated. All right, so that is the CDC website again. So like I said, this is a very good tool, very useful information on here, and how to do certain things, how to go about approaching certain things, cleaning and all that kind of stuff. So very useful website. If you haven't been there before, now you know about it. The second one I want to show you, again, this is just more kind of like hey, this is a cool little website to go to. This is the Johns Hopkins University of Medicine Coronavirus Resource Center, coronavirus.jhu.edu/map.html. This is, and again, I'll put the URL will be in the description of the video for you to click on if you want to go visit this. This is a neat little map. I've shown this before in my Ohio specific videos. You can refresh every time you visit the website. This number changes, and this shows you. This is more for a global view. So if you're interested in the global part of things, you can click on each particular country, and on the bottom right, it will show you their current curve. You know, including China's, so you can see China, how they supposedly in theory flatten the curve. But most other countries have not managed to flatten the curve. China and South Korea are the only two that have managed to start getting to a point where the curve has started to flatten. If you see South Korea here, they're still going up, they're still increasing, but they're at least getting to the point where like the number of cases per day is consistent, or it's not increasing as much, I should say. So they are still getting more cases, but it's not increasing as much. So South Korea looks like they're headed for the curve, but obviously they have not nearly the number of cases that we have in the US or China for that matter. It's like almost 10% of what China has. So, but anyway, so, and you can see in the US, it shows, you can see the spike and how many cases are increasing per day. This website seems to be behind usually by 2 days for whatever reason, 1 or 2 days. It kind of depends on what day you look at it, or how late in the day you look at it. So there's that. So interesting. And again, you can zoom in on any particular area. You can click on a bubble and it'll show you the county in that state, how many confirmed people have contracted the illness, how many people died from the illness, how many people recovered, and how many people actively still have it. So that is the way that works. It's an interactive map. But again, this is a lot better if you have PC. I don't know how well this works on mobile. especially with all of the stuff coming up. And then you also see here they show the total number of deaths, how many people have recovered, and then this shows you a breakdown in this total deaths box of how many people have died by county. And so it's not very helpful. So like if you're just looking for your state, I mean you can click around on your state, but like using this total deaths thing to do that is kind of a pain in the butt. And you can't just click on your state, which is the kind of annoying thing to me, as best I can tell. Oh, actually I take that back. So you can actually click on your state. So if you scroll down here, so like in Ohio, for example, if I click on Ohio, okay, so it does show then, okay, so if you click on admin 2, this admin 2 tab, I didn't notice that before. If you click on admin 2 tab, then it shows you where all the locations are where infections have been reported throughout the state and where the deaths are at. So as you can see in Ohio overall, there's been 19 deaths. So kind of neat. A very interactive map, very unique and very interesting. So again, that's coronavirus.jhu.edu. And again, that link will be in the description. All right, moving on. So this one I just found yesterday. This one is like the coolest one I think I've ever found so far. I literally just found this yesterday on the 27th. So today's the 28th. I found this on the 27th, sometime like in the evening. So this is from Politico, and again I'll put the URL in because it's kind of a long URL. But this is if you were interested in how many tests have been issued in your state. Because, Donald Trump made some claims yesterday, like, we're testing 100,000 people daily. That's what he said. He claimed we're testing 100,000 people daily is more than anyone in the world right now. This site can help you, within reason, prove or disprove that. And this data, and I'll show you exactly where this data is coming from. So there is actually, they specifically cite here that with the help, I'm going to zoom in so everyone can see this, especially if you're on a smaller device. With the help of the COVID tracking project, a volunteer-run accounting of every coronavirus test conducted in America, we're monitoring how many Americans have been tested in all 50 states. The data isn't perfect since the CDC hasn't begun yet publicly releasing the number of people who have been tested. The COVID tracking project is pulling data from state health departments, which can vary in the way they report and test infections. So the data is only as good, and that's the case for data in any circumstance. The data is only as good as the information that's being reported here is only as good as the data being provided. So if any of you computer science people out there have probably heard, or programmers or anything like that, GIGO, garbage in, garbage out, essentially that's the way it works. But according to this project, there's been 686,000 tests given. This is all time in the U.S. since the beginning of this being a thing in the United States, or being discovered at least, or when we started reporting on it. So they also have some interactive maps here, so you can see in this case the red bubble is the number of people who have tested positive. The blue bubble are the number of tests. So it just kind of shows you in a way you can kind of sort of measure like a ratio. We'll get into that. They also have a bar graph here as well, kind of representing that, a double bar graph where it shows like, again, the positive test is the red bar, the total test is the blue bar, or the gray blue bar, or whatever you want to call it. Then the really cool thing is the trends over time. This is, again, like I said, if you're into charts and graphs and numbers and stuff like that, like, and you're a geek like me with this kind of stuff, this is pretty cool. So you can see by state how many tests have been provided in your state. Now this data can urge you possibly to, maybe tweet at your governor and say, hey, why are we not testing as much as other states? You do have to be careful how you read the data, though, and we'll get into that in a second. So in my case for Ohio, it says that there's been 20,000 tests, and it says plus 19,000 since last week. So there's a slight issue with that, and I'll explain why. So you got to be careful how you interpret this data. But there's been 20,000 tests given, 1,100 positive. If you do the math, it's like 1%. For most states, it's about 1% of the people who do testing are testing positive, and that even included New York. New York is still 1%, but there's still a much higher number: 145,000 tests and 44,000 test positive, and it still comes out to around 1%. So that seems to be the trend right now across most states. Now, again, I haven't done that calculation for every state, but I have done that for at least a couple or a few of them, and 1% seems to be where you fall. So now in some it's slightly higher. Like Maryland, there's no way this is 1%. I mean, out of 868 tests, 774 have tested positive. I mean, that's close to 100% of the people that have been tested positive. So that's, crazy. But again, a much significant less numbers compared to other states. But this may be bad because this would tell you that Maryland is not testing as much as they possibly should. Possibly, they could be well behind the curves, so this number could get worse. But anyways, so there's that. The charts are really cool to look at, and so I would definitely consider visiting this site, especially if you're interested in the data. Now, again, this site provides you a link to the COVID tracking project, which is here. That's this website, covidtracking.com. And if you read, they explain to you here the data, and if you're trying to use this data for something, the best ways to use this data, and so on and so forth. But one of the cool things that you can do is, so you can actually, if you actually want to write code around this, and again, I don't know that there's many people that will, but they actually have APIs in JSON or CSV that you can use. So you could actually use this data yourself to create your own charts and graphs and all this kind of crazy stuff if you wanted, that all these other people are. So it's pretty neat. I mean, it's pretty cool. If you want something to do during this time to help contribute to in a positive way to make people aware and all that kind of stuff, you can use this. You can possibly use this data to do that. So I did want to show that off real quick. But just as easily, they have a show me the raw data spreadsheet. And so on this tab, you can actually zoom in for people with smaller devices. They actually have U.S. current, states daily at 4 p.m., U.S. daily at 4 p.m., and states. If you click states daily at 4 p.m., so it looks like, I think they have a job or something that basically runs through at 4 p.m. and collects whatever the numbers were at that point in time. Most states have been, at least Ohio, they publish their numbers at 2 p.m. So I think most states are publishing their numbers before 4 p.m. each day as kind of a general cutoff. So that way, by the time the president goes out to talk and all the media is doing their reports, or the doctors from the states are coming out and talking, they have, at least some number to start with and discuss at that point in time. So if we scroll down to Ohio, and again, I keep going to Ohio because I'm from Ohio. So Ohio will show you, if you look at the tabs here, the tabs are state, how many people were positive, how many people were negative, how many are pending tests, hospitalized, how many people are dead from it, and total number of tests given. So if you look at Ohio has, again, 1137 positive, 19,000 negative, 19 deaths, 276 that are hospitalized, and 20,149 tests given. And this was on 3/27. So this was as of yesterday. So again, 4 p.m. yesterday, this was the number for Ohio. Now I did say earlier that you want to be careful how you interpret some of this data, especially if you're looking at the graphs from the other website where it said there was a plus 19,000 surge. I'll explain why. So if you look at 3/26, Ohio was at 17,000 tests. So between the 26th and 27th, essentially there were 3,000 tests given. I'm going to explain why this is important. And on 3/25, if I look at Ohio, there's 14,764, which means there between the 25th and the 26th, there was about another 3,000 tests given. Now, if we come down to the 24th for Ohio, let's see, at some point, yeah, so for Ohio, if you notice this, there were 704 tests given, and this is where I think you got to be careful, because I highly doubt that if they're doing only 3,000 tests per day, that between the 24th and the 25th, that Ohio actually administered 12,000 tests. I highly doubt that's the case. I think what happened is Ohio may have been one of the states potentially that weren't reporting the numbers the way that they should have been from the beginning, because this data goes back. I mean, if you scroll down, this data keeps going back. And so Ohio has numbers in here but they may not have been reporting correctly. Now, again, there's some research that may need to go into this for me to know like why it was so low here. I highly doubt though that they did 12,000 tests in a day, especially again if the trend shows that they're only doing 3,000 tests per day now, within the last few days. Then I just don't see how it's possible they did 12,000 in a day. But either way, so you can come in here and look at the numbers for your particular state. Now, I think if you go to states, okay, so they show you, if you click on the states tab, they try to explain like how they're pulling in the data, and they give you the link to the site that they're pulling the data from, so you can go check that out if you want to know exactly how they're pulling the data. So I mean, this is as transparent as it gets. I mean, there's other sites that there's another site I'm gonna show you which they're not as clear as from where the data is coming from, and I don't think they give you the raw data. So this is as clear and transparent as it gets in terms of where the data is coming from. So this is really cool that Politico put this together. Really neat that they found that resource. And so again, if you're interested in using this resource, be sure you read their best practices for data release and all this kind of stuff before you go and try to use this data for anything. And yeah, so I did want to show you guys that. I thought that was really cool, a really cool find. The last thing I want to show you is this Unicast social distancing scoreboard. So this was actually shared to me by a friend in my YouTube streams, and so I wanted to show you guys this. So this is, and again, the link will be in the description. Now, again, this is another set of data. You've got to be very cautious about how you use this, and you don't want to ride people too much because of this data, unless you fully understand what the data is telling you. I don't fully understand yet what this data is telling me. I understand the concept of the data, but the changes in the data and how it's pulling that in, again, like you have to just be very cautious of how you use this. Okay, that's all I'm saying. So the idea of the data, though, is that this data is supposed to tell you that before the pandemic started and today, or the day as of on the data that it shows. So like this map is updated as of 3/23 right now. So again, it's already 5 days old. So just be cautious of that. Be cognizant of that. This data is already 5 days old. The idea of this, though, is telling you that before the pandemic started, this is how much people traveled, and then after the pandemic started, this is how much people are traveling. And they're using basically GPS data from people's phone, and I don't know from where. And again, I don't even think they explain on here where they're pulling that from. I'm assuming it's probably through Google or something like that, I would have to imagine. Other than that, I'm not sure how they'd be getting that data. But essentially, it's taking the data from people's phones and GPS information and using that to determine like how much people are traveling before the pandemic and during the pandemic, and then basically doing a difference between that to determine, okay, what's the percentage increase or decrease in travel overall. So if you click on it, you can click on this big map and click on an individual state. So I clicked on Ohio again because I'm from Ohio, so my focus has always been on Ohio. It'll show you the map of where all the numbers are. It'll show you the number of confirmed cases, and again, this is 5 days old, so it shows 149 confirmed cases in Cuyahoga County, for example, and then in Ashland County, it shows they have no confirmed cases. So it'll show you how many confirmed cases are in that county, but again, 5 days old. But then the colors in here represent a grade. So they show you a grade here. So like this turquoise color represents an A. This, I don't even know what color this is, like a turquoise gray. I don't even really know. This kind of puke green, this puke bright orange, and then the orange represents the grade. So the orange is F basically. So that means that people are traveling more in this case, which is weird. And again, like you have to just be, this is why I said you got to be cautious about how you use this data, because in this case, like oranges in this particular county in Ashland, it says they're traveling 5% more than they were before the pandemic, which makes no sense. But then in this case of this other county, okay. So I have to reset the data. Something happened with the data set there. Let's see what happens here. Maybe they got it. Maybe they updated the data. We're having technical problems, people. Let's see. As refreshing the dashboard here, it's still old. I thought maybe they were actually refreshing the data or something. All right. So anyway, you can click on but it shows you by county. Again, the idea is it shows you by county the grade. And so, like, for example, in Cuyahoga County, the change in average distance traveled has decreased by 34%. They give Cuyahoga County a B in that particular case. Now, the other day, so maybe like 3 or 4 days ago, Ohio overall was an A. Now it's sunk to a C because people were traveling more as of 5 days ago than they were probably 5 days prior to that. So I'm not sure like why that is. And so there's nothing on here to really explain that. So again, like, you just have to be careful with how you're trying to use this data. So don't like go reaming people for, hey, why are you traveling so much and this, that, and the other. Maybe people had to go out to the store. So as of a week ago, actually, if you think about it, as of a week ago on Monday, if the numbers came in on Monday, remember Monday night for Ohio was when the governor announced that we were going on lockdown. Essentially, as the stay-at-home order, which it was issued Monday night, the 23rd. It seems like 2 weeks ago at this point, but really it was just this past Monday, if I remember correctly, was when the stay-at-home order was issued, I believe. Jeez. And so that could be a reason why people were traveling a lot more on Monday, because everyone's like, oh God, I got to go out and buy all my groceries and stuff like that. So, it's just something to keep in mind with all this. You really have to understand what factors played a role into this happening. So they also have this neat little kind of line and bar graph at the bottom here showing. See, that's why I said, like, at some point Ohio had a really good number. So for changing the average mobility based on different distance travel, that was in Arkansas. So if I click on Ohio, it'll show you that as well. So, and then the number of new cases is what they're showing there in their bar graph. So and again, this is just more for just, hey, this is cool. It shows you some information. Now you're probably asking, like, how do you know this data is legitimate? So they actually have a link down here to a blog where they describe the rollout of this, and so you can click on that link, and again, I'll put this in the description as well so you can look at it. This explains everything, at least as much as they could possibly explain in a blog post. It's a very short blog post, but they identify like how they're trying to tweak the data and get it to the point where it's actually useful, and they want this data to actually be useful for states and governors and anyone else interested in knowing, like, if people are moving around too much when they shouldn't be, so that they can maybe focus on certain counties and this, that, and the other. So, there sounds like there's actual good initiative and intent here by this company to make this data useful. So again, use it as you may, but like I said, just be careful how you use the data. That goes for any data that you ever use. So with that said, this is a very long video. I did not expect this video to go on for this long, but I did want to show you guys those things. And so I appreciate anyone who stuck around to listen to this stuff. Like I said, the links will be in the description. Guys, in closing, practice your social distancing. Continue to practice your social distancing, even if the county or state that you live in is not highly impacted by this virus. For your sake and for others, practice your social distancing. Stay clean, wash your hands. I can't stress enough, again, I've been stressing the past couple of days in my Ohio specific videos, if you get packages delivered to your doorstep, or anything that's delivered to you, or anything that you're getting handed to you from other people, make sure that once you've touched those things, I would dispose of them, to be honest, like immediately. And then I would make sure I wash my hands, because you don't know who's touched those things, and if they've come in contact with the virus and all that kind of stuff. If it came from a warehouse where someone was infected, you never know. So it's better to be safe than sorry. Be sure to wash your hands as you touch things all the time. And I would say, again, if you want to go out places with your kids and stuff like that, that's fine. But I would strongly urge you to not have them do stuff like touch playgrounds and stuff like that. Like, don't touch anything if you can avoid it. Even outside in your own house, don't touch things because you never know. People walk through your yard, unless you have a secured yard or something like that where people can't walk through there. You don't know if people walk through your yard and touch stuff or whatever the case may be. Just avoid touching anything that you possibly can at this point. And if you have to touch it, that's fine, but make sure you disinfect everything as much as possible, especially if you know it's a commonly touched surface. So I did want to close with that. But thanks again, everyone who watched this video. I appreciate it. And if I come across anything new that I feel like sharing, that I think you guys might want to know about, I'll definitely post another video of it. And until next time, guys, bye-bye.